there are long-standing social inequities that go beyond just coronavirus. When we talk about the fact that African Americans are more likely to be poor, for generations, it's gotten a little bit better since Obamacare, but for a long period of time, they were more likely to be uninsured. The fact that there's also mistrust of healthcare, with good reason, from African Americans, so they don't see doctors. They're more likely to have things like diabetes because we have something called food deserts in our communities where people don't have access to healthy food, so they're eating processed food, which can lead to things like diabetes. They're living in shelter that's not fit really for human beings. And that's one of the reasons why you get diseases like asthma that are chronic. And then when you bring in a pandemic like COVID-19, it's going to exacerbate those diseases and cause massive death amongst African Americans. And you brought up Chicago. We've seen it in Milwaukee, where 81% of the deaths in Milwaukee from COVID-19 are African American, despite the fact that African Americans only make up 27% of the population. And in Louisiana, where they're 33% of the population, they're 70% of the deaths. So we've seen this going from state to state. And even the president, who has had his own issues with race, has acknowledged that this is a problem.